Hi everyone, welcome back. So today's video is going to be looking at the hip flexor muscles and associated injuries. So I'll also be looking at strains of these muscles, and I'll also go on to talk about something called snapping hip syndrome. And I'll describe sort of symptoms and causes and treatment, etc. And as with my other sports therapy related videos, I will also give you some basic exercises that you can do to help with recovery and strengthening of these muscles. So, but we're going to start by talking about sort of basic anatomy and explain where these hip flexor muscles are. Okay, so if we look at the hip flexor muscles, the two main hip flexors are the iliacus. We have it lies between the pelvis here and the thigh bone. So just here, these are the iliacus and also sometimes the iliopsoas on both sides. And we also have the one that runs up here, which is the psoas major, and you also have the psoas minor, which sits just inside here, which runs right up from the lumbar vertebrae down to the thigh bone. So that's a much longer muscle. And these are both, so whereas this one is quite a flat muscle, this is much longer. They're both very deep muscles, obviously, and both of these muscles will help to flex and also rotate the thigh, so internally and externally. Other muscles that flex the hip are the rectus femoris, which is the main one of the quads, which I will be doing a post on the quads, but it's the main one that comes down the front, and it's the only one of the quads that actually crosses the hip as well as the knee. And that muscle would actually also be used in things like lunges and squats. And also you've got the pectineus, which is one of the adductors which sit on the inner thigh, which again there's a video for. And the pectineus is a really short one that sits right up in the groin. So that also can work as a hip flexor. So what are the functions of these hip flexor muscles? Well, the obvious one, as it says, it is involved in hip flexion. So it brings the thighs towards the abdomen by either lifting the knee or by bending the abdomen forward. But they're also involved in spinal stabilization due to the attachment of those psoas muscles, which are the long muscles. They attach at the lumbar vertebrae. So those are the main functions really, is hip flexion and stabilization of the spine. Now, there are various exercises that use these hip flexors. So if we're looking at cardio type exercises, basically, walking uphill, climbing, running, if you do sort of step aerobics or cycling, all of those things are going to be using those hip flexor muscles. But if we're looking more sort of resistance workouts, things like leg raises, sit-ups, jackknives, and also some variations of a plank. But also those power movements, so front kicks, tuck jumps, that sort of thing. So you know, they're used in a lot of our movements. But in terms of sort of what, you know, what sort of things are going to cause injury to these muscles, you know, any kind of sudden movements. So if we're looking at sort of sports, things like football, where you've got sudden sort of starts and stops with a change of direction. But also martial arts, where obviously you've got a lot of kicks, you know, you're going to be more prone to injury. But also things like falls. If you've had any kind of previous hip flexor injury, you're obviously going to be more prone to getting another one. Say it all the time, not warming up properly before exercise. And sort of any overuse, you know, as with all of these sports type injuries, any kind of overuse, you know, repetitive use, or sort of overstretching, which is where your warm up come in. You know, if you're stretching the muscle too far and you've not warmed it up, that's going to cause injury. Also, things like prolonged sitting. So if you're, for example, a taxi driver, so most of your working day you are sitting down with a flexed hip, and so what this does is it shortens and weakens the hip flexor muscles, and then obviously when they're weakened, they're going to be more prone to injury. But another thing is with forced hyperextension of the hip. So sort of if easiest way to explain this, so if you imagine in a standing position, sort of if your leg is sort of forced back, so instead of bending forward, it's, you know, forced back, and it's going to pull down that front of the hip. You know, maybe sort of, for example, in dancers or maybe gymnasts, you know, might be prone to that kind of injury. But also one thing that has been linked to hip flexor injuries is hamstring strains. So, you know, if you've overdone it down the gym, for example, or in a football match, and you've strained your hamstring, you know, just be aware you're going to be more at risk of them putting additional pressure on those hip flexors. So, yeah, just something to be aware of. So, if we look at the injuries to the hip flexor and think about what kind of symptoms we might experience. Now, obviously, as with all of these muscle strains, you know, the symptoms are going to depend on whether you've got a grade 1, 2 or 3 type strain, i.e. whether it's just a few muscle fibres that are affected, whether it's a partial tear, or whether it's a complete rupture of the muscle. But generally, hip flexor strains, you know, or even of that, you know, rectus femoris that comes down the front of the thigh there, and also groin strains usually occur from explosive movements, at which point quite often there will be a sort of a feeling of like either a pulling or possibly even a popping, particularly sort of if it involves, you know, if it's more of a ligament injury or tendon injury. And usually, you know, the athlete will not be able to continue with, you know, the activity. So we've mentioned there about the different sort of grades of muscle strain. So if we're looking at grade 1 strain, which is mild, and just really involves sort of pulling to some of the muscle fibres, it's a mildly painful tear, which, you know, it may cause mild swelling and tenderness, but regular activity in this case can usually continue and full recovery, you know, in a couple of weeks. But if we look at the more sort of severe strains, so we've got a grade 2, which would be seen as moderate. So this is where there's a partial tear in the muscle that causes moderate pain, limited movement at this point, possibly limping, swelling and tenderness. And with this grade strain, sports activity will stop because there's likely to be around a 50% loss of function. And recovery may be from sort of a few weeks to a few months. So, you know, you definitely with grade 2, you know, you're going to need to be resting as much as possible. Then you've got your grade 3 strain, which of course is the severe strain. It's a complete muscle tear, and it will also cause a lot of swelling and inability to weight bear. And with this one, you know, over 50% of your muscle function is lost. You know, with the grade 3, it's possible you may even need surgery to repair the muscle, and recovery is going to take several months. So you're not going to be down the gym anytime soon. Now, there are also some things that will sort of increase, you know, the likelihood of injury, or, you know, that can occur sort of as a complication. So the first thing I'm going to talk about here is hyperlordosis, which if we sort of think that the hip flexors attach to the spine, those psoas, those long psoas muscles attach onto the lumbar vertebrae. So if they're tight, they can actually cause an unnatural curve in the spine, which will affect, you know, obviously how any force impacts on the spine, and sort of the shock absorbing capabilities, you know, of the body in this area. So because of this unnatural curve, obviously it can cause lower back pain, weak abdominal muscles, weak hamstrings and tight low back muscles. There's also something called snapping hip syndrome, which I'm going to go on to talk about towards the end of this video. You know, so tight hip flexors basically can also cause the pelvis to tilt forward, which can also cause lower back pain. And if for those of you with pelvic tilt, I have done a video on pelvic tilt, so do take a look at that one. And so if this is an issue, to counteract this, you know, you have to stretch those hip flexors out and release that tightness. And also you need to strengthen those abdominal muscles, because where obviously everything's pulled tight and it alters your posture, the abdominal muscles may, you know, may then sort of weaken, you know, through overcompensation, etc. So if we look at the symptoms of a hip flexor injury, you're looking at, again, it depends on, you know, on the grade of the, you know, strain, but we're looking at limited range of motion, poor posture, sudden sharp pain at the front of the hip, maybe a pulling sensation around the front of the groin, particularly, you know, if you're rising up from, say, a squat. You may get cramping and tenderness into the upper thigh, and also bruising to the hip and thigh area, certainly, you know, with those higher, you know, grade strains, that's going to be an issue. You may get swelling to the hip and thigh. May also be muscle spasms in the hip or thigh, so, in a grade 3 type strain, and also, difficulty walking. Potentially, an inability to kick or jump or sprint, and just general discomfort when moving. Possibly there may be limping, again certainly sort of probably grades 2, grade 3, you're looking at limping, and also you may feel some stiffness after sort of standing or sitting still for a while. So in terms of treatment, how to deal with a muscle strain in this area, you can protect the area from getting worse by using a brace, and really it's about resting as much as possible for the first few days, certainly, again dependent on what grade strain, and avoid any activities that cause pain. Use ice packs to relieve pain and reduce any swelling. And if possible, apply sort of immediately for about 20 minutes after the injury, and then every maybe 3 to 4 hours for the next 2 to 3 days. In terms of compression, obviously it's not the easiest area to, wrap, but if swelling is an issue, you can sort of wrap the area lightly, or probably best where you can get compression shorts, and just elevate the leg as much as possible to reduce swelling and inflammation around that hip area. Obviously pain relief, sort of anti-inflammatories, obviously being cautious with something like ibuprofen if you're asthmatic or you have cardiac, kidney or blood pressure issues, or also gastric ulcers. If you're doing sort of these things and after a couple of weeks there's really no sort of improvement, do see your GP, or physio or sports therapist. With a grade 3 you may need to use crutches until it's completely healed, and possibly even surgery to reconnect the muscle, but that is rare. Also actually trigger point therapy can be really beneficial in terms of relieving pain. But if you're wanting to prevent a muscle strain here in the first place, then there are some things you can do as well. We've already mentioned about warming up properly before any exercise and cooling down afterwards. And if you take a look at my previous video on different types of stretching, that will explain sort of what types of stretching are best when, because sometimes people use, for example, static stretching before going off to, say, I don't know, play a football match, and actually that's not the best type of stretching. That's better for cooling down afterwards, and I'll explain why in that video. Just strengthen your muscles by regularly stretching, and work on strengthening those core muscles around the abdomen and the lower back, and also the glutes, because they work together with the hip flexors to stabilize that whole hip joint. Tightness in one of these muscles can cause injury in another. So ensure full recovery from an injury before returning to your usual workout routine. And as always, when you are going back after injury, just make sure that you're building up gradually. So I'm going to talk a little bit about some exercises that you can and can't do with a hip flexor injury. So exercises that work the hip flexors, we're looking at things, obviously it's anything that flexes the hips, so we're looking at things like sit-ups, leg raises, hanging leg raises, resisted hip flexion, so if you have hip pain, you may need to avoid, you know, these type of exercises, and also, as I've said, reintroduce exercises gradually when starting after recovery from injury. So in terms of if you're a cardiovascular kind of workout person, you know, you want to be avoiding exercises that subject the hip joint to stress or repeated bending. So you're not going to want to be doing running, jumping, step aerobics, or using the rowing machine or going cycling, because that's just going to put more stress on that joint. In terms of strengthening exercises, you know, you want to be avoiding any exercises that subject, again, the hip joint to repeated bending or stress. So here I'm talking about things like lunges and squats. You know, they're really not going to be good exercises to do at this time. You know, and even some, you know, if you're someone who goes down the gym and really uses the machines more, there are even some machines that, while they don't specifically work the hips, they still require bending of that hip joint, which may make the pain worse. So, you know, if you are a gym goer, you know, just talk to one of the personal trainers there as well, you know, just to get their advice. In terms of contact sports, you know, anything where there's repetitive twisting and pivoting movements, so things like golf, tennis, football, maybe basketball, all of these can make a hip injury worse. So contact sports such as football, rugby, martial arts and wrestling should also be avoided due to the risk of the painful joint receiving a sudden blow, you know, maybe through a tackle, you know, which obviously would then worsen the injury or potentially, you know, injure one of those other areas around the hip joint. In terms of stretches, you know, just avoid any stretch that would require you to spread your legs wide. So a lot of those adductor stretches for the inner thigh will require you to do that. Anything that you need to bend forward or potentially lay on your side, because it may be painful if the hip bone on your injured side presses into the floor. Anything that requires knee flexion, so if you need to bring your knee past hip level, that's going to be sore. Or anything where you need to swing the leg across the body, you know, where you're going to be working on that rotational movement of those muscles, you need to be careful. So even with gentle exercise such as yoga, you know, you may need to adjust certain postures to avoid pain. But I do have some basic exercises that I'm now going to show you, which will just help to strengthen the hip flexors, you know, and prevent injury. Okay, so first we have our single leg squat, which focuses on the hip flexors, but also engages the core and the leg muscles, and certainly that rectus femoris down the front of the thigh there as well. Then we have the seated butterfly stretch, which you can start by doing in the sort of upright sitting position. And here, so this is going to work as well on that pectineus muscle, which is right in the groin. It's actually one of the adductor muscles from the inner thigh. You just sit upright, bring your legs out either side, feet together, and just push the knees down and start to lean forward. And as you feel stronger, and if pain allows, you can then gradually start to, lean forwards just as far as you can, but, this would be sort of the end aim. But if you can't get there, no worries, and just lean right over the feet. We then have the pigeon, and then the one-legged pigeon pose from yoga. So these are really obviously stretching down the front of the hip there, and also on the other side right into the groin and even around the glutes. But again, it's, going at your own pace as your body allows. Then we have some other yoga poses. So we have the bridge pose here. You're just going to lift the hips up and feel that stretch all along the front there. We have the bow, which is where you'll be reaching behind you to grab the feet up. Obviously knee flexion, and you'll get the stretch again down the front. And the camel pose. And obviously these yoga poses are great for also stretching out around the abdominal areas, increasing flexibility around the spine as well. And then finally you have your lunges, where you're going to be pushing the front of that hip down towards the floor. And of course, you can also do things like straight leg raises as well. Now, when you're recovering from injury and you're just starting to reintroduce some exercises, probably the best things would be things like swimming, water aerobics, or, if you like walking, then just walking on a soft surface rather than concrete, because these exercises are actually going to put less stress through that hip joint, and there's, it's going to be lower impact. So they're the best things to start with. But if you're used to strength training, it's probably best to focus on upper body exercises that won't place any stress on those hip joints. Okay, so as I mentioned earlier in this video, we're going to look at something called snapping hip syndrome. Now, there's two types of snapping hip syndrome. There's internal snapping hip and also external snapping hip. So first off, the internal snapping hip syndrome, you can see the psoas muscle here. That's the one that attaches up on the lumbar vertebrae. Internal snapping hip occurs when the iliopsoas tendon, which is down here, catches on the femoral head, so the ball of that ball and socket, or it can catch on the iliopectineal eminence, which is here, during hip flexion. So it's basically that tendon getting caught, almost kind of like an impingement, so then we have the external snapping hip. And the internal, by the way, is sometimes also known as iliopsoas tendinitis, because of that tendon being the one that gets caught. But external snapping hip syndrome, so this involves the gluteus maximus tendon and also that IT band, which is that sheet of thick fascia that runs down the outer thigh. And I will also be doing a video on the glutes. I have already done one on the IT band, an injury there. So do take a look at that one also. So external snapping hip occurs when the gluteus maximus, up here, where the tendon or the iliotibial band catch on the greater trochanter, which is part of that bone up at the top of the thigh bone, during flexion. So, iliopsoas tendinitis, which was the internal, is inflammation of that tendon due to trauma, overuse and repetitive hip flexion. It's often seen in dancers and gymnasts and also runners. And as I say, that tendon just rubs on the hip bones, causing pain, stiffness, and a snapping sensation with flexion and extension of the hip. Whereas the external, it's that gluteus maximus and the IT band, which just catch on the bone, which again can just rub, and with overuse, much like IT band syndrome, it just can cause inflammation, and also can affect the bursa, which are those fluid sacs in the joint. So I'm going to talk about the bursa now, because something called iliopsoas bursitis, which is inflammation of the iliopsoas bursa, that is also linked to snapping hip. And the bursae are small fluid-filled sacs that basically sit between the bones and the soft tissues to cushion the joint and basically reduce friction, when you move. So if we look at the hip joint, you've got all these little fluid sacs, and the one that causes the main problems is this one, which is the iliopsoas bursa. Obviously, you've got that iliopsoas muscle that comes down through this area. And so when that becomes inflamed, obviously it's going to affect all those surrounding tissues there. When it becomes inflamed, obviously it's going to rub against that thigh bone there and those surrounding muscles and the hip flexor muscles, which come down here. So who is most at risk for snapping hip syndrome? Well, it seems that women are. Now, whether that is something to do with, and if you've seen my videos on pelvic tilt and femoral acetabular impingement, I talk about the Q angle. So that's the angle at which the thigh bone falls down from that hip joint. And obviously in women, because they have naturally wider hips, a wider pelvis, the Q angle is much greater than in men, who the angle is sort of straighter. Could be due to that. Other people at risk are the elderly, anyone who has had prior hip surgery or injury, anyone who, kind of has overuse of the joint, so whether that's through maybe occupational or through being down at the gym, whatever it may be. It could be standing for long periods of time. So again, for example, if you're a theatre nurse, you're going to be standing quite often in one position, which puts obviously a lot more pressure on those hip joints. Any biomechanical issues. So for example, if you've got a leg length discrepancy, again, that's going to affect your posture and the angle of those hips. or anything like scoliosis, spinal arthritis, or any other kind of spinal issues, again, will all sort of bring about postural changes. And also rheumatoid arthritis is thought to be a risk factor as well. And also, potentially if you have, some people just naturally develop bone spurs, like little growths of bone. So if you develop for whatever reason, little bone spurs around the hip, or calcium deposits, again, that could cause, the bursa or the muscles to just rub, and, so it would just cause friction, and then inflammation starts to arise. In terms of symptoms of snapping hip, so we're looking at things like pain and tenderness in the front of the hip, and sometimes in the upper thigh, and particularly sort of with the external snapping hip, and the pain will probably get worse when bending the hip. So when you're walking, if you're going upstairs, squatting, sitting, these are the things that are going to make it worse. Pain is usually quite sharp initially, but it can turn into more of a dull ache. You may experience a clicking or snapping at the front of the hip, which is just where the muscle kind of catches on that bit of bone and sort of flicks over, hence the name snapping hip. And there may also be tenderness, in the hip and the groin area. In terms of treatment, it really requires rest, usually for 2 to 3 weeks, possibly anti-inflammatory analgesics, maybe steroid injections in worst cases. If you're having trouble walking, you may use crutches for support, and also looking at physiotherapy, or sort of seeing a sports therapist for massage treatments to just, help, ease any tension, maintain flexibility, but also to support, to stabilize the hip area by working on those surrounding muscles, and just, help reduce any overcompensatory, injury to those surrounding muscles as well. In terms of preventing this, if you are in one of those at-risk categories, it's really about warming up, cooling down when doing exercise. And if you're starting a new exercise program, build it up gradually. And doing regular stretches will also strengthen those hip flexors and really help to improve your flexibility. So it's really common sense things, yeah, hopefully that has given you a basic overview of not only of the hip flexor muscles but also of snapping hip syndrome. As always, feel free to subscribe to my channel. I have lots of other videos already up on various medical conditions and how massage can help, mental health issues as well, pregnancy, disability, and I've already got various other sports massage related videos up, but I will be doing some others on other muscle groups. So do subscribe and you'll be notified when they come out. Feel free to comment down below, or if you have any questions you can contact me through my Facebook or Instagram pages, which I believe the links are down below, and I will answer you. And that is really it on this topic. So thank you for watching, and do take care, and I will see you next time. Bye.